Okay, so let's get started. So hello, everyone. Welcome to the Environmental Research Seminar and actually webinar for today. I'm Song-Gyun Park, faculty member of Epidemiology and Environmental Health Sciences. So this seminar series is sponsored by the Michigan Life Stage Environmental Exposures and Disease Center, in short, M-LEEaD. So before I introduce today's speaker, please note that you can use Q&A on the bottom to enter your question during the presentation, and we will cover your question after the talk. So I'm very pleased to introduce today's speaker, so Dr. Meredith Pedde. Dr. Pedde is an environmental epidemiologist and research assistant scientist in the Department of Epidemiology here at the University of Michigan. Dr. Pedde is one of this year's M-LEEaD Center scientists. So she previously worked at the US EPA's Office of Transportation and Air Quality. Dr. Pedde's research focused on the health impacts of mobile sources, with a particular focus on understanding the impacts of clean school bus upgrades on student health and academic performance. She is also interested in understanding the role of air pollution on neurological diseases. So please join me in welcoming Dr. Pedde.
Well, it's my pleasure to be here today and to share with you our work we've been conducting for the last few years, looking at assessing the national benefits of the EPA's school bus retrofit and replacement program. And so this work that I'd like to share with you today was actually just published last week by the Health Effects Institute, or the HEI, who is the funder for this project. This work was done in collaboration with Dr. Sarah Dar, who's a senior faculty member here at U of M SPH, and who is the PI in the study, as well as Dr. Richard Hirth, a health economist here at University of Michigan, and Dr. Adam Spiro, who's a biostatistician at the University of Washington. And as the title states, the aims of this project were to study the health, education, air quality benefits of the U.S. Environmental Protection Agency's school bus rebate program. So I'd like to start with our motivations for the project. So on the left here, I'm showing another HEI report that was published almost 15 years ago now, that conducted an extensive review of the science of the health effects of traffic-related air pollution. And unsurprisingly, they indeed found that traffic-related air pollution is bad for health, and it's linked to many adverse health outcomes such as asthma, impaired lung function, and even mortality. So we know that traffic sources in general are related to adverse health effects, but the particular transportation source that we were interested in this work were school buses. And so in the US, over 25 million students ride buses to school each day. And while school buses have been shown to be the safest way for children to get to school from a traffic accident perspective, the use of older school buses can expose kids to high levels of diesel exhaust during their commutes, since the exhaust can enter the inside of the school bus either indirectly through leaky cabins or directly through open windows or when doors open and when students get on and off the bus. And so, in fact, earlier research has shown that concentrations of some pollutants can be as much as 10 times higher than those, concentrations inside the bus cabin can be up to 10 times as high as those in the ambient air, which means that even a short school bus commute can dominate a child's daily air pollution exposure. Not to mention the fact that most school bus riders are riding the bus every day for the whole school year. And while urban and suburban routes are typically shorter in duration, rural school bus routes could be much longer. And in fact, we've talked to some transportation managers who've said that their rural students spend 1.5 hours on the school bus in each direction every day. So this is definitely a transportation source that warrants further study. So there's also evidence linking these school bus air pollution exposures to health. So for example, Dr. Adar's earlier work in Washington State found that students who rode school buses with clean air technologies had lower absenteeism, lower pulmonary inflammation, and improve lung function compared to students riding buses without these technologies, and that the results were strongest among students with asthma. Another study in Washington State found reductions in bronchitis, asthma, and pneumonia incidence as a result of a different school bus retrofit program. And in Georgia, a different bus upgrade program was linked to better educational performance and attendance. And so while we know that school buses can increase students' air pollution exposure and that older buses can be associated with worse health and educational outcomes, new diesel school buses can cost anywhere from $100,000 to $300,000. And so therefore, the average school bus is on the road for 16 years before being decommissioned, which means that millions of children in the US still ride older, highly polluting school buses to school each day. So to hasten the transition of older buses to newer school buses, in 2012, the US EPA started providing funds to school districts around the country under a program called the School Bus Rebate Program that was part of the Diesel Emissions Reduction Act. And so the program awarded funding to school districts that applied for the aid to replace their older buses with newer buses. And because emission standards have been strengthened over time, these newer school buses are also cleaner and less polluting than the older school buses. But now, since the EPA didn't have enough funding for all of the school districts that applied, they implemented a random lottery to select which school districts would be awarded the funding. So the table here shows some information about the 5 years of the Clean School Bus program that we assessed in our study, which included the years from 2012 through 2017, with the absence of 2013 when the program was not run. So you can see there were requirements for the age of the old buses that were to be replaced, as well as for the replacement buses. And school districts were allowed to submit 1 or 2 applications each year, depending on the size of their fleet. And each application could cover rebate funding for 5 to 10 school buses, depending on the year of the program. So over the 5 years of the program that we studied, there were over 3,000 applicant districts, 430 of whom were randomly selected to be awarded a total of over $27 million in clean school bus funding through the lottery. Now, as I mentioned, the EPA used a random number generator to allot the clean bus funding, which from a research perspective is, of course, the holy grail, since very few environmental exposures are distributed randomly, which means that all sorts of different things could have the potential to confound the observed relationships between the environment and health. But here, with the clean bus funding being awarded randomly, this greatly reduces concerns we might have about other factors confounding these associations, and allowed us to study the impacts of this clean school bus funding in a more causal way. And so the specific impacts that we were interested in studying here were attendance, health, educational performance, and community air quality. So again, since the funding was awarded randomly to study these different outcomes, we were able to use randomized control or RCT approaches, just like you would do to study the effectiveness of a new medication, to basically look at the difference in each outcome in the year after the lottery as compared to before the lottery by lottery selection status. So for example, we evaluated whether or not the districts selected for funding in the random lottery experienced increases in attendance after the clean buses that were not observed by districts that were not selected for funding in the lottery. And since there was nothing stopping the districts that were not selected for funding from still purchasing newer buses, in our analyses, we used intention to treat, or ITT approaches, to maintain the benefits of the randomization and minimize bias. So this diagram is just a brief look at our hypotheses, but essentially we hypothesized that in the districts that were selected for funding, there would be lower personal air pollution exposures for students, which could lead to better health, which could then lead to fewer hospitalizations. We also hypothesized that better health would lead to fewer absences and ultimately better learning. And then we also hypothesized that better health could lead directly to improved learning, since there's evidence that short-term air pollution can directly impact cognitive ability. And then lastly, we hypothesized that in the selected districts, there would be lower air pollution exposures to the broader community. So to conduct these analyses, we first gathered information from the EPA through a Freedom of Information Act request that included information on all the district applicants, as well as which district an applicant served in the case where the applicant was a private bus transportation company, since they were also eligible to apply. The EPA also had data on the number of buses each applicant entered for replacement funding, and each applicant's selection status in the lottery. And then for the applicants that were awarded the funding, we also had information on characteristics of the original buses, including the model years and whether the funding was used to replace or retrofit the bus, as well as confirmation that the funding was actually used for bus replacements. Now, on the outcome side, we collected data on school year annual attendance rates from individual state departments of education for each applicant for the school districts before and after the lottery. And so the before year would be before the new buses were in place, and the after year would be the school year immediately after the new buses would be in place. We also collected information from the U.S. Department of Education on baseline characteristics for each applicant, and that included the number of students and number of schools in each district, the geographical size, boundaries, and urbanicity status of each district, as well as data on the percent of district students that were eligible for the free or reduced price lunch program, which is often used as a proxy for a district SCS, and then information on the racial composition of each applicant district. To study the health effects of the Clean School Bus program, we used data for children aged 5 through 18 who were enrolled in the Medicaid program, who resided in zip codes that intersected the school district applicants. We used the claims data for this population for all ED visits from respiratory causes, as well as counts of the total number of children on Medicaid in these same zip codes to define the denominator of our emergency department visit rate. And again, we collected this data for the school year before and after the lotteries. And I'll mention for those that don't know, Medicaid is a national health insurance program for individuals and families with incomes at or below about 133% of the federal poverty level. And nationally, there are over 30 million children enrolled in Medicaid. To look at the education impacts of the Clean School Bus program, we use data from the Stanford Education Data Archive, which takes individually administered state testing data and then harmonizes and standardizes the scores across the states and across years so that the scores can be comparable across time and place for the whole US. And then the actual data product is a normalized standardized testing score for all districts for 3rd through 8th graders, separately for reading language arts and for math testing. And again, we're collecting this data for all district applicants before and after the lotteries. And then for our last outcome, to look at the community air quality impacts, we merged PM 2.5 or fine particulate matter estimates that were generated by researchers at Washington University using spatiotemporal prediction models. These estimates were available at a 1 by 1 kilometer grid cell for the whole US. We then took those data and linked them to the school district boundaries across space and time so that we could calculate school district average PM 2.5 concentrations for each applicant school district in the years before and after the lottery. And then before I move on to our statistical approaches, I'll note a few exclusion criteria that we included. So first, we excluded, we restricted our analyses to entrants that served individual school districts, since they could be linked to the outcome metrics. So this means we excluded private bus transportation companies or consortium entrants who represented multiple school districts. We also excluded entrants that represented private or non-traditional or tribal schools, since the attendance and education data was not consistently available for these schools. And finally, to prevent outliers from impacting our findings, we excluded entrants who had changes in attendance rates of 5 percentage points or more between the before and after years of the lottery, since this cutoff was consistent with the literature for reasonable levels and seemed to be consistent with observed errors. And then lastly, we were not able to include data for the approximately 7 million children who are enrolled in the what's called CHIP, the Children's Health Insurance Program, which covers low-income children whose families don't meet the traditional Medicaid income thresholds, since they did not use consistent unique identifiers across calendar years, which means that we couldn't create school year count rates, since a school year spans 2 calendar years. So for our statistical modeling approaches, again, the funding was awarded randomly, so we're able to use RC2 approaches to study each of these outcomes. We used simple linear regression for all of the outcomes except for the emergency department visits, and that was modeled as a Poisson and adjusted for population size. And in our primary models, the dependent variable was the outcome, so attendance, for example, in the year after the lottery, while we adjusted for the outcome, or in that case, attendance, in the year before the lottery. The independent variable of interest is the district selection status. So the beta 1 here in this equation would be our ITT effect, or our measure of interest, representing the effects of the funding program. To maximize power, we pooled data across all 5 lottery years, but we do adjust for lottery year here, since there were the percentage of applicants selected in each lottery differed across time. We also adjust for whether or not the district submitted more than one application in a given lottery year, as well as for EPA region, since in some years EPA regional offices had additional funding beyond the EPA headquarters funding, which they distributed using the headquarters randomized ranking. So a limitation of this work is that, of course, it's at the ecological or district level. But we, of course, know that not all students in a district ride a school bus, and then not all of the bus riders will be on the new buses. So to try and get at this, we, in secondary analyses, we stratified our results by the fraction of children, or rather quartiles of the fraction of children who are likely to be on the new buses, which we estimated by multiplying the number of buses requested for replacement by 72 seats on each of those buses, and then divided by the total number of students in that district. We also know that not all replaced buses are the same. As I mentioned, EPA emission standards have been strengthened or improved over time. So to get at this, we looked at the effects by the age of the buses that were requested for replacement. And specifically, we looked at categories of pre-1990 model year buses, 1991 through 1999 model year buses, and 2000 and newer buses. Okay, so for some results, our data capture was generally very good for attendance, ED visits, and PM 2.5. But you'll see here it's lower for our education outcomes, which is largely due to the fact that the harmonized data were not available for the 2018 through 2019 school year, which would be the after year of the 2017 lottery. So for those outcomes, we were only able to look at the first 4 years of the EPA funding lottery. Okay, so this is a bit busy, but the main takeaway here is that randomization was successful. So we are looking at the impact school district characteristics separately for the selected versus unselected districts. And we generally see that everything's similar across those two sets of districts. There were some differences in baseline attendance and ED rates in the year before the lottery. But again, as I mentioned, we are adjusting for baseline levels of each of our outcomes. Yeah. Okay, so now I'm going to go one by one through our main findings. I'm going to start with attendance. And I'll mention that the results for this outcome were published last year in the journal Nature Sustainability. So in our primary model, we observed greater improvements in attendance after the lottery for selected applicants compared to the unselected applicants. And the results here are a 0.06 percentage point improvement, which translates to 6 additional students being in school each day in an average size district of 10,000 students. And again, our analyses was at the school district level, meaning that not all district kids rode the buses. So if we look at the results by the fraction of kids who are likely riding the replaced buses, we see that in the group with the highest proportion of kids riding the buses, we see an even greater impact. So reaching up to 14 more kids per day in the districts with the highest ridership. Conversely, there was no improvement among districts with the lowest proportion of kids riding the applicant buses. And similarly, we know that not all buses are equally polluting, and so that in general, the oldest buses are the highest polluters. And in fact, we do see that in the older buses, the effect size was much more dramatic. So replacing buses that were older than 1990 model year resulted in 45 more kids per day in school in an average size district of 10,000 kids. The effect was smaller for districts replacing 1990s model year buses, and then we saw essentially no impact for districts that replaced a 2000 or newer model year school bus. And when we take these main results and project the overall national impacts of the program, we estimate that an additional 350,000 days of attendance occurred in 1 year due to the program across all selected districts. And then if we further extrapolate our findings out to the full US population, and we imagine a world where we could remove all buses that were pre-2000 model year, we estimate that we could see an additional 1.3 more student days of attendance per year. Next, I'll turn to our health outcomes, which again is in school-aged children who are eligible for the Medicaid health insurance program. And so what you'll see here is that overall, the results are actually counter to our hypothesis, suggesting that school bus replacements were associated with an overall increase in ED visit rates for respiratory causes in school-age Medicaid enrollees. That said, the associations were largely imprecise and generally cannot be statistically distinguished from no association. But notably, there was also no logical dose-response relationship by the model year of the replaced buses with this outcome. So far, we've seen evidence that the funding program was associated with better attendance, but not hospitalizations. So next, we'll turn to the educational performance outcome, and these results were published earlier this year in JAMA Network Open. So here we largely found null results overall, as well as when we stratified by ridership levels for both reading language arts, which is on the top, and for math, which is on the bottom. But when we looked by model year of the replaced buses, the findings were similar to attendance, with us finding this large impact among the districts that replaced the pre-1990 model year buses, and again, essentially no effect for replacement of the newer school buses. And to put these educational results into perspective, we estimate that for the almost 500,000 students in the US who we estimate attend a district with a 1990 or newer, older bus, replacing the buses would be projected to improve RLA test scores by an amount that's equal to a 10% increase in the average district income, and math scores by an amount that's equal to a 4% increase in the average district income. And then lastly, in terms of the impact on the community air quality, we again saw little impact overall or by quartiles of the number of buses requested for replacement. But when we look at the results by model year, we again see a strong effect among districts that replaced the pre-1990 model year buses. In fact, we found an almost 1 microgram per cubic meter improvement in the districts that replaced the oldest buses. So in summary, in this work, we were able to leverage the random assignment of funding to more causally study the association between clean school bus funding and measures of health, education, and air quality. And what we found was that for districts that replaced the oldest buses, there was evidence of greater improvements in attendance, learning, and community air quality, but no evidence of an effect on respiratory-related hospitalizations among children in Medicaid. And we saw some evidence that there were stronger improvements when even more buses were replaced. So again, just to reiterate, our main takeaway is that we see the strongest effects in districts that replace the oldest buses, and that there's additional impact of the stronger impacts when more buses are replaced. So in spite of this ideal study design, given the randomization, there were, of course, still limitations to this work. So first, as I said, the results were at the district level, which mixed bus riders and non-bus riders. But that said, bus emissions can impact non-riders when school buses idle outside of the school where a child might be learning or waiting for other transportation sources. Secondly, Medicaid data is at the zip code level, which could include students enrolled in the applicant districts as well as students not attending the applicant districts. But both of these issues should dilute our findings, and indeed, and other sensitivity analyses suggest that is the case. We also had limited information on the replaced buses, such as condition or maintenance history, which may be important since, again, we're finding evidence that characteristics such as bus age are important to our findings. And then lastly, we don't know if the unselected districts ultimately did purchase a clean bus with other funds. We do know that there were 29 districts that were selected in the lottery who ultimately did not purchase a clean school bus with EPA funds, perhaps due to difficulties finding the matching funds. But again, as I said, we used intention to treat approaches, which should retain the benefits of randomization and minimize bias and would dilute our findings. So all of that said, the study has some significant strengths. So first, while other studies have looked at other smaller clean school bus programs, this was the first evaluation of the EPA's national clean school bus rebate program. And then, of course, the randomization was huge and helped us minimize our concerns about confounding and selection bias, and ultimately helped us have stronger causal interpretations. The data also allowed us to compare the impacts of the program by bus age, which again should be related to bus emissions. And that, of course, is the take-home message here. So the most important thing that we tell anyone when we talk about the results of this work is that the most important thing and the most important priority should be to get the oldest buses off the road in order to reduce children's exposure to air pollution and the subsequent consequences of those exposures. And with that, I'm happy to take any questions.
Hey, great. Yeah, this is very interesting data. So, okay, so for those who have any question, please use Q&A. So you can enter your question, and then we can take care of your question. And so while so the audience think about the question. So let me start a few questions. Okay, so then okay, you are comparing the year before and the year after this rebate program, and but I don't know how logistically it works. And so once the school district receive the funding and the rebate, and then but replacing bus could take time. So the right after within a year, I don't know how many buses can be replaced. And so can you talk a little bit more about the rationale to choose just 1 year before and the 1 year after, and also if there is any possibility that because the replacing the buses take time and then that can impact your results?
Sure, it's a great question. So we kind of lucked out here from a research perspective in that the way EPA administered the program, the applications for the funding were due in the fall. And then, of course, it takes time for the program to, take place. And so it was almost always the case that districts were purchasing their new school bus in the summer after the lottery. So if the lottery applications were due in November, they were purchasing the buses in the next summer, and then those school buses were going to be first time in use that following school year. So there was this really clean break between when the old school buses and when the new school buses would have been used, which occurred in the summer. So we have this nice break, and then the reason we chose just the year right after and right before was to just get those years that were most proximate to when the new buses would have been in use in the case of selected applicants. But that said, right, we think that it's we're only looking at that year right after, so it's possible that our results may be minimized because we're not accounting for any improvements that it might occur after that or over time, because we're only looking at the 1 year after.
Okay. All right. And then we have one question. So that Meredith, you can see the question directly from the your side, but we are recording this, and then we will post this to the YouTube. And so for those who will be watching this presentation later, so I'm going to read the question, but you can directly look at the question. So can you tell us more about differences between rural and urban buses and how that impact this study? Is there a suburban category?
There is. I believe it is urban, suburban, town, rural is how the U.S. Department of Education categorizes school districts. And the reason we were interested in this was that, again, there's some evidence that school district or that a bus route, the length of time a child is on a bus differs by type of district. With, in general, students who live in rural districts are spending more time on the bus than students who ride the bus and attend a school in an urban or suburban area. So we thought this might kind of be a way to look at a little bit of the dose of a school bus that you're receiving. And so when we did look at results stratified by urbanicity, we actually did not find kind of any clear evidence of a dose response by that, which could be due to, just perhaps the delineation of school bus routes isn't quite as clear as geographical status.
Maybe as a follow-up question. So this is my observation in my children that so they use school bus when they were elementary, the student, and then but when they become a middle school and high school, actually my son and my daughter, they use school bus until the middle school, but after high school, and that they no longer use school bus. And there are many reasons, and one reason for me was that the school bus doesn't come to close to my house, and they had to walk a lot. And so that's why instead of let them use school bus, and I gave them ride. And I think this is similar to many other area. So when children age, and then they less use the school buses, and so this benefit could be higher among elementary school compared to a high school. And but your study, you included all the school ages, right?
It's somewhat differed. So for the attendance rates, that was across all students in a district, K through 12.
Okay.
But the educational data, that was only available averaged over 3rd through 8th graders. So the test scores were just for 3rd through 8th.
So more younger children. Okay.
Yep. Medicaid, we limited to 5 through 18-year-olds. So again, looking at the full school age range. But right, I mean, there is this trade-off, right? Because again, the Department of Transportation has studied this, and they have found that indeed, from a safety standpoint, right, the safest way for a child to get to school is a school bus. I don't know if they account for kids walking to the school bus stop or not in that calculation or not, but right, from a safety standpoint, school buses are extremely safe, but it does raise this additional exposure that other students aren't having.
Yeah, so actually my question was, so if you see, have you seen any potential effect modification or stratified by the school, the grade, and so you see more a stronger association among younger elementary school age versus the older age. But you mentioned that so that is only for the attendance, but not the the running and reading score.
Yes, sorry. Okay. So yes, unfortunately, we only have attendance data. It's already averaged over K through 12, so we're not able to look at attendance effects by school age. But the nature of the education data is we are only looking at it for those younger ages. But that's that would be an interesting hypothesis.
All right, so we have a couple of more questions from the audience. So let me read the question from Jennifer Head. So great talk, Meredith. You integrated so many unique data sources in your study. I'm curious if you could talk more about your experience using FOA to get data for this study.
Yes, I will say that when I worked at EPA, I was on the other side of things. So I spent time responding to FOIAs. So I feel like that kind of helped me, that I was already aware that this kind of avenue existed to ask for data and what you might be able to ask for. But that said, I think that maybe from start to finish, it took about 6 months from when we submitted the request to when we ultimately received the data that we were asking for. But overall, the EPA was extremely generous in helping us and getting us the information that we were requesting to be able to do this study. And I do think there are, depending on how much data you're asking for and how much time EPA estimates that it will take to get the data or to kind of generate or collect the data, that it can, I think maybe it was on the order of $1,000 to get the data, but it depends on how long they estimate it will take to gather the data for you.
Okay. All right. So the another question from Jennifer Fernandez. So are there any plans to change the random lottery to get funding based on your data? The effects are greater for replacing older buses?
That is a fantastic question. I almost put this in there, but it wasn't quite ready for prime time yet. But yeah, another reason that we looked at the years we looked at is that from 2012 through 17, it was a pure random lottery. In more recent years, EPA has actually switched to having prioritized lists of districts. So not all districts have the same likelihood of being selected in the lottery. And they're basing the priority districts on district SES and rural status, as well as tribal districts. But we actually, there's a group called the World Resources Institute, which has done this huge data collection effort, collecting data on the ages of school buses for all districts in the US, and the number of buses by different age categories. And so when we merge that to the EPA lists, we're finding that there's still, that only about half of the districts in the US that have a pre-1990 model year bus are being prioritized by the EPA right now based on those other metrics. So there definitely could still be low-hanging fruit for sure available to minimize kids' exposures. So perhaps, and including, maybe not instead of, but including bus age in the prioritization list would be a great way to improve the kind of administration of the program.
But then, do you have information about like the buses, manufactured pre-1990 versus like the 2000, and then their engine equivalent, so they are generating the same level of diesel, or like the buses after 2000 already have a better engine, better like this filtration system, and so that's why less diesel, going to the cabin, and then the student have a less exposure.
Yeah, I have a chart in there, but basically there's a couple things happening. There's both the emission standards were strengthened over that time period. There was a big improvement, I believe, in 2002 when the emission standards were increased by, I believe, an order of magnitude. But also there was the adoption of the ultra low sulfur fuel. Although never mind, that would have happened for all the buses. But really, it's the emission standards for the model years have been strengthening over time, and there were kind of big improvements at those cut points that we looked at.
So then the policy, derive changing like the manufacturing process, and then the engine, engine standard, and that also makes some difference in exhaust. And so.
Yeah.
Yeah.
I don't know the exact the engine things that they're at. I mean, yeah. There are things that are changing about the engine to make them more efficient and less polluting over time.
Maybe I don't know. So you like one slide you show, like earlier slide you show that the rebate program pay like a 15K to 25K. So so that's the amount of money for each bus.
Mm-hmm.
Okay, so then they use, so 15 to 25K is not enough to buy a new bus, right?
Right.
So then mostly they use that money to replace only the engine, so using the retrofit engine.
That is a great point. I did not mention this. So while the program allowed districts to use the funds for either bus replacement or bus retrofit, in actuality, only one district elected to use the funds for retrofit. So in all the other cases, districts were using the funds to purchase a new bus. But you're exactly right that they're having to come up with the remaining funds on their own. Which when we compare the districts that applied to the program to all U.S. districts, because of that, right, they're a little bit higher SES than the average district, right, because they have to be able to come up with those remaining funds themselves.
Okay. All right. So let's see. Maybe I can ask one more question. So for the a future direction, so and then this random lottery, I don't remember actual number, but so the school district that receive this rebate program cover only like a 10%, 20%. But still, a number of school districts use these old buses, and so that's why the children in those districts, they still exposed to this diesel just when they are riding buses. And so what could it be? So how much do we need to successfully replace all these buses? And so that could be one. And then do we also want to consider, because these days, electric bus is another option, not just diesel bus, right? And do we want to try even not replacing, all the diesel to new diesel, but we need to better go to like replacing to electric bus?
That is a fantastic question. So right, and very relevant. So in the recent infrastructure bill, actually, they allotted $1.5 billion to the EPA to give to school districts to purchase electric buses. So the years that we looked at of the program, there were no electric buses purchased. But now the EPA's funding is almost exclusively, exclusively for that program, for the purchase of electric buses. And so it's really, it's a growing movement. And there's WRI that I mentioned. They are very committed to, helping school districts transition to electric school buses. But that said, it's a new technology, and we don't actually know that much from the in-cabin experience on electric buses. So we've done, Sarah has looked on some testing in some school districts a few years ago. So it was like the first generation of electric buses. But that said, there are higher levels than we had expected to see inside of an electric bus compared to newer or older diesels. And our hypothesis is that the electric bus battery, it's hard for it to generate enough power to heat and cool the inside of the cabin. So in some cases, at least at that point, this might be changing, but school districts were actually installing diesel-generated heaters inside of the electric bus to warm the cabin. And so then, of course, that diesel generator was impacting the air quality inside the electric bus. So this is actually something that we're hoping to look at next, given the growing interest in switching the fleet to electric. And then with respect to replacing all of the old buses, right? So I think based on EPA's, the mobile sources, the MOVES model, where they estimate emissions, they estimate that about 1% of the fleet is pre-1990, and about 10% of the fleet is 1990s model year bus. So, right, we're not talking about a huge segment of the school bus fleet, but we are still estimating, right, that there could be about 500,000 kids riding these pre-1990 buses. So I think it's, definitely should be the priority of the EPA's funding.
Yeah, so hopefully they should be aware of this study, and then this very important and interesting finding can make a huge differences in the future, in the near future. So these young children, they can benefit from this this change. And I also appreciate this very interesting study, and as an epidemiologist, this randomization is a very important research design, and then so I appreciate this excellent study. So to conclude, our next seminar will be, we will have Dr. Matthew Campen from University of New Mexico, who will be talking about microplastic, the use and then deposition in brain, which will be also very interesting topic. But please note that in 2 weeks, there will be an election day. And so everyone should go and then do a vote. And so that's why the next seminar will be the following day, the Wednesday, not Tuesday. So we will so send announcement, and then you will receive the calendar invite. So please make sure that our next seminar will be on Wednesday, not Tuesday. And please do make a vote. And then, so thank you again, Dr. Pedde, and then thank you everyone for attending this seminar. Bye.
Thank you.